this routes of administration is the most important topic in pharmacology. So what is routes of administration? Like we have a drug, okay, this is a drug is called medicine, so we have to give it to the patient. So how we will give it to the patient? There is ways, okay. One is it's locally, okay, like if we have pain in stomach, we have to give it to the stomach, so it is local. Where we have pain, we have to apply it there. Wherever the location it is, we have to give the drug to that location. But it's not practically possible in every scenario. Like we can't apply directly to liver, we can't apply directly to intestine, like that we can't do. So other way of administration is systemic. We have to give the drug to systemic circulation, which is blood, okay. So systemic is there. So in systemic, which are the various ways we can give the drugs, and which are the various ways which we can use, then the drug will be reached to the systemic circulation. The ways is, one is enteral, okay. Enteral means nothing but into the intestine, okay, that is enteral. And parenteral route, okay, other than enteral, which is parenteral, okay. So enteral routes are, first is oral route and another is rectal route, okay. One we can give through mouth or we can give through rectum. So these are the two ways we can have enteral routes, okay. And we will discuss one important concept later in another video, which is in oral there is first pass metabolism. First pass metabolism is an important topic which we will cover later. So you just have to remember this word, first pass metabolism, okay. So this is high in oral route, and rectal route also have this first pass metabolism, but it is relatively low, okay. And parenteral route is two types. One is injection and another is non-injection, okay. So injection, what are the ways we can give injection? Okay, we can give through subcutaneous, and we can give through IV, intravenous, we can give through intramuscular, we can also give through intradermal, okay. So and non-injection, which are the ways of non-injection? Sublingual, we can give like below the tongue. So we can give it by sublingual, we can give it by nasal route, like nasal drops. So the nasal mucosa will absorb it. Then we can give by inhalation, like in asthma patients we will give inhalator, so they can get into the systemic circulation by these are the routes, okay. So these are the main things we have to know about routes of administration. Now we have to know the routes of administrations. IV is there, IM is there, subcutaneous is there, and intradermal is there. And we have to know how we will inject IM. Like we have to keep the syringe in a like 90-degree angle, then we will inject directly into the muscle. IM is intramuscular, so we use the angle of 90-degree, okay. And in subcutaneous, we have to tilt the syringe like to a 45-degree, so we are giving it in a 45-degree angle. And subcutaneous 45-degree, and IV is almost 25-degree, okay. And intradermal, it is like almost zero. It is, we have to put it in the skin, intradermal, okay. So it is zero, almost zero, okay. Now we will learn about IV, okay. First we have to learn about IV. And IV we can give in two types. One is bolus, one is infusion, okay. So bolus is like in a syringe, okay. This is a syringe, and the syringe have the capacity of 2 ml, 5 ml, like that. So what we will do is we will get an ampule. So in that ampule, maybe 2 ml, we will say it as 2 cc, like, okay. So we will take that ampule, we will fill all the medicine in that ampule into the syringe. So it is bolus. So we will inject the bolus. Okay. And infusion is, and IV, what we have to do? The main point of our drug administration is we have to get the drug into the systemic circulation. Systemic circulation is nothing but blood, right? So by giving IV, we are directly injecting the drug into our blood. So we will get result very fast. We will get the action fast. So we will use IV in emergency cases, and all that we have to use IV only. Okay. Giving directly into the blood, so we should keep it sterile, so otherwise infection will occur. Okay, so we have to keep it sterile, that's the main thing. And IV, we need an expert to administer the drug, so we can take it by ourselves, and like that. So IM is also, we can give 5 to 10 ml IM, and it is also needs someone else to administer it. We need an expertise for that. And subcutaneous is like in we can administer like all other have fast action, but this subcutaneous is the only method which we can administer by ourselves. Okay, we don't need any expertise. That's why the insulin like drugs in diabetes, we are giving to the patient, so patient can take, they don't have to go anywhere. Okay, like that. And intradermal is like, it is for test allergy only. Okay, so we will give any medicine, we have to check if a medicine we are giving is allergic to the patient, so we will give this medicine intradermally, only few very low dose only we will give, and we will wait for 30 minutes to look for any rashes or any edema or something in the skin. Okay, that's, we will wind up this routes of administration with this topic. Okay, this only the main things you have to remember.